My name's Annie. I graduated from St Hilda's just over 2 years ago now, and since then I've been working in Newcastle doing my foundation training there, and I'm currently taking an F3 year before I do any other further training. I'm sorry I can't be there today. I'm hopefully at the time of the conference in Greece on Lesbos doing a couple of months' work there. So I'm here to talk a bit about my elective. So I did my elective in 2021, which was a bit of a COVID year, so we couldn't go abroad for it. So I did 3 weeks of paediatrics in Oxford, and then the second 3 weeks, myself and a friend made up a sort of expedition rural medicine elective. So the first week of these, we were learning a bit more about rural expedition medicine, did a couple of online courses. I met with our supervisor. She was a super cool ED reg who basically locumed for part of the year, and then the rest of the year went off to some amazing places as the expedition medic. So she gave us some tips about what you actually do and what to expect and how to get into it as well. Things you have to deal with vary from injuries, bites, heat stroke, to then potentially really dangerous things like um, altitude sickness and haze. I guess being prepared with the right kit and the right knowledge is the main thing. But then one of the most underappreciated things, sorry, she said, was that you've got to always be kind of on and supportive to the group. Um, Even if you're knackered as well and wet and in pain on day 6 of the trek, you still got to be there to reassure that miserable person with a tick bite that they'll survive, and also to check that the person with the headache is actually okay. And people look to you when they're a bit miserable for some sort of reassurance, which I guess is often also seen in the NHS, in that even if you're a bit hungry and tired, you don't express that to the patient because it's not going to help much in terms of them feeling better to know that. But yeah. The next week we went on the mountain leader training course in the Lake District. This was based in Grange near Keswick. Um, it was a 5-day course, and there was about 7 or 8 of us on it, a mix of ages, but really nice people. So the first day was all about navigation. I'd never really done any navigation like this because you weren't allowed to use kind of rivers and fences and things like that on the map. It was contour lines only. Is anything else um, could potentially change and then could result in your group getting lost. So just contour lines. Um, and then on day 2, we looked at steep groundwork and leadership skills and practice different leadership styles. So basically just trying to keep your group safe and supported but also challenged, and assessing the group in terms of their ability and their confidence into how you would be best leading them, whether they'd more appreciate something from the front, from the back, or individual support. Day 3 was more about navigating in the day and then the night. So in the night, it's more important your bearings and your pacings. I'd never really realised navigating from pacing was a thing, but you have to know exactly how many of your steps is 100 meters. And if you're at night and you've got nothing else going, you just do the steps and count them over and over again. And the leaders of this training course are incredible at being consistent and knowing exactly whether they're going up or down hill, exactly how far they've gone. Day 4 was more navigation and river crossings, and then day 5 was more medical, looking at, well, first we did search and rescue techniques, and then first aid measures such as making a pelvic binder if you're in the middle of nowhere. And we visited the Mountain Rescue Centre in Keswick, where they have all sorts of medical kit that they take to their emergencies, including enough to do a trachea up on the mountain. Yeah, they're incredible people that work for them. So on reflection, I guess there are a lot of skills that I practiced during this week, which are transferable between mountain leading and medicine. So there's the obvious team working and leadership, thinking about different strengths of each team member, and making sure communication between everyone is very solid. and reliable. Um, and then other things such as adaptability and resilience are very important in both settings. I'm not sure whether I'll ever become a qualified mountain leader, because to do that, you then have to, before you can even do a further week similar to this one, but as a test or assessment, you have to log like at least 90 quality mountain days, which are days where you're up in the mountains, normally mainly in Scotland, they like best, just leading a group in all sorts of different weather conditions, um, summer, winter, everything, um, which is quite a lot. But maybe I'll get into it, and if medicine doesn't work out, it'll be a good option. Oh, and then the third week of our elective, we were supposed to be with a rural GP in the Lake District, and it'd been quite hard to find one because of COVID. And then a couple of days before the one that we'd found before we were supposed to start, they had to cancel because of illness. So we couldn't find another one in time. So we made the most of our accommodation in the Lake District and did some practice mountain leading and walking, and practiced a good work-life balance, which is another important skill. So yeah, we had a lovely time. It was a lovely week. So yeah, I think even though that COVID changed plans, I still had a great time and appreciated the chance to explore how versatile a career in medicine can be, and the other things that you can do with it if you think outside the box a little bit. Um, and yeah, I really appreciate everyone who helps fund the elective fund at Hilda's, because it is a really great experience that everyone gets to go and try different areas in medicine. Yeah, so if anyone has any questions about the Mountain Leader course, or any students want to ask about Northern Deanery and coming to work here or anything like that, then please do get in touch, and thank you for listening.